Good afternoon, Nicole. How are you doing today?
I'm pretty good, I think.
Yeah, sounds like it's been an adjustment period. You've just, recently moved to the nursing home.
Yeah.
How has the first week been for you?
Up and down, some good, some bad.
Okay, well, that's a victory in itself, and I'm really proud of you, as your therapist, that you're going through this transition, and it's a lot.
It is a lot. So, it took a long time to make the decision, and it's a lot different than being at home.
Right, and I know it wasn't an easy decision. How has your relationship with your husband?
Well, it's different being here. He has to come and visit. We're just not together all the time.
I see.
So, that's a big change. We've been together most of our lives, so that's kind of lonely a little bit, at the times he can't be here. But, he comes to visit me every day.
He does.
Oh, of course. Yeah, he wouldn't just and he's lonely too now. He's home alone, so it's a change for both of us.
Right. So, I know there were a few reasons that brought you to the nursing home, and I just kind of want to check in and see how you're doing. It sounds like you're at least acclimating pretty well, considering this is, a new living space. You used to live in a 2-story home with your husband and your grandkids, in and out of the house. So, I'm very proud of you for being so brave and adjusting. That it's a change.
Yeah, well, I feel like in some ways I don't have a choice. I mean, I didn't ask to have osteoporosis, and it's hard to accept getting older and not being able to move, and being so afraid all the time that I'm gonna fall and get hurt again. And
When was your last fall, may I ask?
I think it was almost a year ago.
A year ago, okay. And how have you noticed any differences, in your mental health since the fall? Is it kind of based on this anxiety of falling again?
Well, yeah. I mean, I was always, it's hard to not be independent anymore and to always have to plan, I can't even just get out of bed or get up from a chair without thinking about it, and being worried all the time if I fall and what's going to happen if I fall, and what's going to get hurt, and should I get up and do something or should I just sit here, and it's just worrying all the time. So I'm still worried about should I call for a nurse, should I get out of bed myself, is it okay if I walk down the hall, or should I wait till someone takes me?
I definitely sense the anxiety level is kind of peaking, and what we can do here in therapy is how to cope with that anxiety. And I recognize you have the anxiety disorder and you are taking medication for that, and we can discuss that later. But an important part of therapy is going to be about developing coping skills to deal with those anxieties and those stressors, because we want you to be as comfortable as possible in your living environment. And you've been through a lot to get there. So we want to make sure you feel safe and never feel afraid that you're bothering anyone. Have you developed any relationships or friendships with some of the staff, or?
Oh yeah, the caregivers, they're all very nice, and I guess I just don't know what I'm supposed to do and what I'm not supposed to do, and I don't want to break any rules, I don't want to do the wrong thing, I don't want to get hurt again if I shouldn't, so it's it's just confusing to know what I should and shouldn't do, and what if something happens, and it's just a lot of changes and a lot of different things.
And a lot of what I'm hearing you say, Nicole, is this kind of should have thing. What should I or shouldn't be doing thinking. And I totally understand that we're all guilty of that at some point, but I really, really want to work on with you in our work together is how to avoid that shoulda, woulda, coulda mentality, that living in the moment, being present, and not stressing so much about what could possibly happen and anticipating the worst, but okay, what is happening now? What is the reality, and how to, when something does happen, how we can use our coping skills we've developed to kind of calm that anxiety.
Okay, so how do I cope with that?
Well, one way, at least dealing with the stress of not knowing what to do or what if I fall again, should I call a nurse? There's no wrong answer in the environment where you are. You should always feel safe. So if your safety and your health, if you ever feel that's being compromised or if you're at risk, then the reality is to call a nurse or to press the button. That's
But if I think I can do it myself, is it okay to do it myself?
of course. I mean, you're in a nursing home facility because your family felt due to your osteoporosis and your anxiety disorder that your husband, the fact is he can't be there 110% of the day. You do need some assistance, and I recognize that that's losing some of your independence, and that's something we can talk about here in therapy is how to cope with that loss of independence.
Right. I mean, like I know, like to take a shower and get dressed and everything. I know I need help with that. That I don't feel comfortable doing that totally on my own. But then like, can I, like walking to the dining room for breakfast? If I, is that okay if I just walk there myself, or is that not allowed, or is that not a good idea?
There really is no good or bad idea in that scenario. You do what's comfortable for you, and we can work on it in therapy. And we have a network where I can speak with your care providers at the nursing home, and if there's anything you feel is not being met, we can address it. I would say just make goals for yourself. That okay, today think about what you can do in the here and now. Today I'm gonna walk to breakfast.
And that's okay?
Of course that's okay. And if something were to come up, there's the staff there to help you. You can always press that button. You'll see your friends coming to breakfast as well, and no one's gonna leave you alone if you need a little extra help to get there.
Okay.
So that's something we could talk about here is, kind of balancing that idea of, coping with, loss of independence, but also, as you point out, maintaining your sense of self. And that's something we don't want to go away, while you're here, is that you are unique and you are your own person. And I think that's great to have goals, to go to breakfast on your own or go to activities or, really anything. Sky's the limit. There's nothing you shouldn't be able to do based on your condition.
Okay. But if I can do everything, then why do I need to be here?
That's a good point. And I think something we can work on together is understanding your husband's role in this. That, I've spoken with him, the doctors have spoken with him, and he isn't capable at, he's 78 himself. You're 75, he's 78, and he just feels he can't provide for you and be there for you the way you need him in case you were to get up during the night and maybe have a fall. He feels...
Oh, I don't want him to be responsible. I know that's been a big, big problem, and I don't want him to have that responsibility. So that's why I know I came here. But now I just want to know for sure what I can do on my own and what would be dangerous.
Maybe another way we can think of this challenge is that what we are capable of doing. And as you pointed out, Nicole, you are capable of, you are getting up in the morning, you do need some assistance getting ready, but you are able to get to breakfast. That is in your control. And something we can deal with your care team is kind of coming up with a plan that promotes your independence, respecting your wishes, because that's what's most important here. And then also something I wanted to touch on, the combination of how your anxiety disorder medications might be impacting your daily life. And that's something, we want to work on in therapy is how you're feeling with your medication regimen. I know it's been quite a few years since being diagnosed with an anxiety disorder, and I think that's maybe something we can talk about here, is how you feel about being on that medication and how it makes you feel.
So, I mean, I don't know, I've been on it for so long, I guess it just feels normal to me, so I don't know how it makes me feel, but, that's the medication I take. So, should it be different?
Well, as your therapist, I can work with your psychiatrist. So the conversations we have here will influence the care you're given by your psychiatrist. And according to my records from your psychiatrist, you know, you seem to be on a good combination of medications, and you know, your doctor understands you do have a family history of anxiety. And I just wanted to ask you, do you feel they're helping? You know, we just want to, in therapy, we want to make sure that all the therapeutic approaches are in line. So that, do you feel they're helping?
Well, I don't really know what to compare it to. I mean, I still worry about a lot of things.
And that's natural.
So, you know, like, how do I know if they're helping or not helping?
I think something to remember here is you haven't had this your whole life.
Mm-hmm.
And do you remember a time in your personal life when you weren't an anxious person? Have you always felt that way?
No, I remember when I wasn't, but you know, it's been a while, and I don't know. Can I feel that way again? That I'm not anxious?
Well, that is the goal of the medication, is to treat your anxiety disorder. And so if we feel there's a gap in what the medication is doing, I think that shows us that in therapy we have a lot of work cut out for us to help you feel your best.
Okay.
How has your sleep been, Nicole? We want to keep a close eye on your sleep patterns. I know the care team at your nursing home is very good about and diligent about checking sleep for their patients. How has sleep been for you overall since moving in last week? How's your sleep
I've been sleeping okay. I mean, sometimes it takes me a while to fall asleep because everything's so different. But I don't feel like I'm not sleeping. I feel kind of rested, and I think I'm sleeping okay.
Okay. And you're able to go about the day. Do you ever need to take a rest or a nap period during the day?
Sometimes I get tired in the afternoon, so sometimes I want to rest for a little while.
Okay.
So, but it's like not all day or anything.
Okay. Well, that's definitely something we'll keep watching. But I'm glad you're not experiencing any major difficulties with that. That can sometimes be a response to the medication. And I will certainly update your psychiatrist about our session today. It sounds like there's maybe some unresolved issues with, is this a normal feeling? Am I feeling more anxious, less anxious? And you've been through a huge life change. You've moved from living in the house with your spouse of, how many years have you been married?
48 years.
Wow, 48 years to now you're not living in the same space, and that's a huge change. And you want to be able to give yourself the time to grieve that loss of having your partner in the same home, and maybe that was something you didn't think about consciously before this happened, your fall and your diagnosis of osteoporosis. Maybe this is something you hadn't thought of before, but just living in a different space from your spouse, that's a huge life change.
Oh, I know. That's that's was the major problem with making the decision to come. For us to be apart is really hard, and I worry about him being home alone, and he worries about me being here. So, it's been a lot of worry for both of us.
Mm-hmm.
It's not what we're used to.
And something we can work on is how to address those thoughts and those feelings and those emotions and then make a conscious decision with our behavior. And what I like to do here in therapy is take an approach where it is in our control. If we feel a certain way, we can work through those feelings and emotions and make an appropriate decision so that we don't set ourselves up for failure, for example. So, what are some ways we can kind of promote this positive thinking? That, let's say you're in a scenario in your new environment in the nursing home that makes you uncomfortable or anxious. What are ways we can cope with that in the moment to help us through those difficult situations? So maybe we can work through that together.
Okay, well, if you have suggestions, that would be good. Do you have any suggestions for me?
I think being able to recognize what is really happening versus this feeling you're expressing to me and worrying about the future what if scenario. What if I fall? What if this happens? What if emergency happens? What do I do? I think in my experience as a therapist, being able to evaluate what's really going on in the here and now, and then from there, we can kind of adjust our reaction to things. So let's say, the example I used before about should you get help going to breakfast or do you think you can go on your own? If a day comes where you do feel like you do need help, that's okay. Not to feel, that you shouldn't have to feel ashamed or resent that, okay, I need help to get to breakfast. I need to get to breakfast. How can I get there? And the staff is there to help you. So there's really, there's a solution to the problem, and it doesn't have to exacerbate the anxiety. And we really want to limit and take control of that anxiety and not let it diminish our quality of life.
So I think right now some of my anxiety is not being sure what the rules are here. And, I don't want to be breaking rules. I don't want to, be doing things I'm not supposed to. So, that's one of the big things I'm worried about a lot since I moved here. What's okay and what's not okay, and am I doing the right things? Am I not doing the right things? Or who decides? And I'm used to my own house. I can do whatever I want.
Right.
And so now I'm not sure if what I want to do is okay or not.
You bring up a really good point, Nicole, because you're in a new environment with new people, right? You're with new friends, new acquaintances who are also in the nursing home, the staff that you're just learning to, learn who those people are, and the nurses and the doctors. I think it's okay at this stage to be a little apprehensive. I mean, you're, a week in at the nursing home, and you're making great strides already. So again, that positive thinking, kind of patting yourself on the back and giving yourself acknowledgement that, this was my first week. I thought it was going to be really hard. It was, but I'm doing it. And keeping that positive mentality, because, the fact is you're not in a crisis mode. You didn't have another fall. You did not have an episode. And, being in the nursing home is a way for you to be in a place where, in case something happens, you can still have meaningful relationships with your husband, with your children, with your grandchildren, making your room a comfortable space for them to visit and for you to feel at home is important. And maybe we can talk about that. Have you thought of some ways to make your room here a little more comfortable?
Oh, yeah, no, my children have been really helpful for that. They brought a lot of things from our house. I have pictures of everybody.
Right.
There's even some books and toys for my grandchildren when they come to visit. So, my room feels like my room, which is also a little odd since I've shared a bedroom all my life, it seems.
Exactly.
So just having my own room takes some getting used to, but it feels like my things that are there. And when my husband comes, we spend time alone there together. It feels we watch TV together. But that's another thing. Is that okay if I'm in my own room and not in the main room? If the two of us are watching TV together and have some time alone together, I just want to be sure that's okay and we're not doing anything wrong.
Of course not. And I think you hit it right on the head. It's important to make it feel like this is your home, and as long as you're following your doctor's orders, and there should be no reason why you shouldn't have that time alone with your husband, or time playing with your grandchildren. That's really, kind of the goal, is to have that combined, safety net of having those nurses there in case something were to happen, God forbid. But at the same time, like you just mentioned, having that comfort. This is your home now, and you should never feel that you can't have family come visit or spend that quality time. I think it's really important, and the fact that you've been there, Nicole, about a week, and you're already developing these skills to make this new place, this new environment feel like home is a really good sign.
Well, I'm glad to hear that, because I always worry if I'm doing something wrong or what I shouldn't do. So I'm glad that it's okay for me to spend time in my room when I feel like it, and that's okay.
Of course, and that's the goal for anyone who's in your situation, is to feel as comfortable as possible given the circumstances. And I know it was a tough decision. It sounds like for your family, for moving from the home to the nursing home, and it's a decision that had to be made, and it really does seem like you're making the best of it. And something we can work on in future sessions is this kind of unresolved feeling of anxiety, this anxiety that is still there, and I think, in combination with the medications, I think it's important in the therapeutic setting to address any changes in that anxiety if we can really pin down where it's coming from. If we know the source of it, we can really discuss the issues around it and kind of get to the root of it, so you don't feel you're carrying that weight with you all the time. Because I sense that you have this extra anxiety with you that you're taking everywhere with you. And the goal of managing anxiety is to make it manageable so that you can go about your day and not feel so restrained by it or so taken up by it. Does that sound?
Well, if I didn't worry so much, that would feel good. I mean, to know what's okay and what's not, and not to be worried all the time. That would feel really good. So do you think there's different medication that would help?
Since I'm not your psychiatrist, I can't prescribe the medication, but we can work with some different categories of medications for people with anxiety disorder, like yourself, and kind of make our own combination of medication that works for you. So if we try a medication eventually down the line that doesn't agree with you, we'll find one that does. There's a multitude of medications available, and I really think in your case, Nicole, the main anxiety we're going to have to address here in therapy, because I feel like from what you've told me, it sounds like this anxiety you have is, the medication might not take away all of, these medications only work on certain chemicals in your brain, and I think what we need to retrain your brain is focusing on the here and now, focusing on what's really going on, so that we don't stress ourselves out to the point of that we can't function, or to the point that we're not enjoying life. And so our goal here in therapy is to manage, the medication, the environment you're living in the nursing home, your acquaintances and friendships, your family, and then how that all comes into play, that because your feeling of that anxiety, that's accurate, you're feeling that. But there's ways to cope with it and to adjust with it and to live with it, that you shouldn't have to suffer, but at the same time you can still lead a meaningful life while coping with that anxiety.
So do you have ways for me to cope with it?
I think being able to take that mindset of what's happening here and now, and recognizing, what do I really need to worry about here versus what's one thing I could check off the list to not worry about right now, here and now? Or what can wait? Can I put this on the shelf? Is a phrase they use a lot there about what's something I can put in the back of my mind. It's still there, so we could put it on the shelf, and it'll be there when you need to get it, but you don't have to walk around all day, every day, worrying about it. And then when you need to deal with it, you can pull from that shelf. So that's a strategy. And another strategy one of my fellow therapists taught me years ago that's been really helpful for some of my clients is imagining the anxiety you're feeling, that stress. And kind of putting, instead of putting it on the shelf, putting it on a leaf in a river and just let it flow by. Or another example I've heard is put it, that stress and anxiety, that worry on a cloud and let it dissipate, let it move by. And, these ways of thinking are just some strategies that have really helped some of my clients, and very much research has been done on sort of this mindfulness-based cognitive behavioral therapy, which I know is a lot. It's a big word, and you don't have to worry about that, but being able to create coping skills that help you when you're feeling stressed.
So how do I learn all these things?
In combination with you living in the nursing home now in your new environment, you'll pick up on skills just automatically when you start thinking of how to be how to positively cope with that anxiety. And in our work, in our sessions, that's what, if you choose, we can focus our work on that. I think a lot of the anxiety you're feeling, it is real, but it's more than you should have to deal with on a daily basis. And so kind of taking these examples or strategies, if you want to call them, of putting it on the shelf, putting it on a leaf, putting it on the cloud, can help alleviate some of that stress in the short term.
So I'm just supposed to figure out how to do that and go do that on my own?
That's a good point. It's a strategy, and it's a different way of thinking. We're going to work on retraining your brain to think that way, to when you're in a stressful situation or even a non-stressful situation, you're feeling these levels of anxiety that are more than what there should be, you can kind of, in your head, calm yourself down and say, okay, what can I do with this feeling? What's really happening here? And what can I do with this feeling? Can I put it on the leaf and let it go down the river? Or do I have to deal with it right now? And you will, with time, with practice, with us working together in therapy, you will develop those skills. And before you know it, it'll become second nature.
So you're going to help me with that. I don't have to do that all by myself.
Definitely. I'm here every step of the way. We can schedule additional therapy sessions if you feel like, Stephanie, I'm really not really understanding this, or I'm having trouble with this. The goal of this should be to help you. You shouldn't feel like this is a homework assignment. It's more of how to alleviate some of the stress. And so I'm here as your coach and cheerleader to guide you and give you strategies, so when you come in here, we can kind of, go over what's been going on with you and realize you can do this. And you've been here a week and you've done so much. And that shouldn't go unnoticed.
Well, I'm glad there's like something else I can do and that I could learn how to do, and you think I'm not too old to learn something new and how to do it. So, that's reassuring to me that I can learn how to do that.
Of course, and these techniques, are based in this mindfulness approach of, not worrying so much about the past or the future, but just enjoying the moment, enjoying that time with their grandchildren when they come to visit, playing with grandma, or, enjoying that time watching a movie with your husband, being in the moment and enjoying things that used to bring you joy, you should still be able to get enjoyment from it. We can kind of monitor that and see, how you're coping, these strategies and these coping skills that will give you the tools that when you are in a situation where if you feel anxious, there's a way to channel that so it doesn't debilitate you and you can still get through it. And if that makes sense, that you can get through that kind of tense feeling and you can really master how you think about it and how your reaction to it is not, for example, your reaction to anxiety in a stressful situation a couple months ago might be different than your reaction to a stressful and a situation that, you might experience in the near future. And so we want to make sure that you feel comfortable with these tools, and we'll refine those along the way.
Okay.
And I think this will really be an effective approach for your treatment. I really see, the progress you made in 1 week is remarkable. So I
Thank you.
applaud you for that. And, that's a big deal. And really working on these strategies to cope with the stress and anxiety as opposed to letting it impair you is really going to help us, make some meaningful work out of therapy.
Yeah, I'd like to learn how to do that.
Okay. All right, well, I think that's it for today,
Okay.
Nicole, and I will check in with your doctor or your psychiatrist.
Okay.
Well, as you mentioned, I know you mentioned about other medications available. I'll check with him and see if he has any new notes for us, but I'll see you same time next week.
Okay.
And thank you for sharing, and
Well, thank you for helping me.
of course, that's what I'm here for.